In this video, I will cover some common spinal cord lesions and their effects. Spinal cord injury may be caused by trauma, for example, accidents, falls, tumors, and infections. Effects of injury depend on the level and severity. There may be complete transection with total loss of motor, sensory, and autonomic functions below the lesion, or incomplete injury with some preserved functions. Common syndromes include quadriplegia or tetraplegia. This usually occurs in injury above the level of fifth cervical vertebra. There is paralysis of all four limbs. Paraplegia occurs when injury is below the level of first thoracic vertebra. There is paralysis of lower limbs only. Brown-Sequard syndrome, also known as hemichord lesion. It is caused by penetrating trauma or due to lateral compression. Effects include ipsilateral or same-side loss of motor function and fine touch and proprioception due to affected corticospinal and dorsal column medial lemniscus tracts, respectively. Contralateral or opposite side loss of pain and temperature sensation due to affected spinothalamic tract. Anterior cord syndrome may occur due to flexion injury or anterior spinal artery infarct. Effects include bilateral loss of motor function and pain and temperature sensation due to affected corticospinal and spinothalamic tracts, respectively. Preserved dorsal column functions like fine touch and proprioception. Central cord syndrome. It is usually caused by hyperextension injuries such as in elderly with cervical spondylosis. Effects include greater weakness in upper limbs than lower limbs and variable sensory loss. Sacral sparing is common. Posterior cord syndrome. It is usually caused by trauma, vitamin B12 deficiency as in subacute combined degeneration, and tapes dorsalis occurring in neurosyphilis. Effects include loss of proprioception and vibration sense below the level of the lesion, preserved motor and pain and temperature functions. Syringomyelia. It is characterized by the presence of a fluid-filled cavity called syrinx in spinal cord, commonly found in the cervical region. The illustration on the right side shows a syrinx in the cervical region of the spinal cord. Effects of this condition are bilateral loss of pain and temperature due to crossing fibers of spinothalamic tract in anterior white commissure, cape-like distribution over shoulders and upper limbs, motor deficits if it progresses to anterior horn cells. The last one is spinal shock, occurs after acute spinal cord injury. Temporary loss of all spinal cord functions below the lesion. Flaccid paralysis, areflexia, and loss of autonomic function. It may last days to weeks, eventually replaced by spasticity and hyperreflexia. With this video, we have completed all the important topics related to the central nervous system. To help you with your revision, MCQs and detailed notes will be uploaded very soon. So keep an eye out for those. If there's any other topic you'd like us to cover, or if you have suggestions, please let us know in the comments or send us a message. Thank you for learning with us and happy studying. Subscribe the channel and follow us for more high-yield medical videos.